Welcome back to the Better Health Now podcast. Today, I have a new physician here at Cullman Regional on the podcast, Dr. Eric Goodrich. Thank you so much for joining me today.
Hey, how are you doing?
Doing good. So so your first day was 2 days ago.
Yes,
So
has a lot going on in the past couple of days for sure.
yeah. Give us a little background on you. Talk a little bit about where you're originally from and sort of your journey to get here to Cullman.
Yeah, it's been a long journey. It's been 19 years in total.
Wow.
So I grew up outside of Pittsburgh, Pennsylvania. So I am a Yankee. So that's the first thing I do reveal to everyone in the South. But very small town I grew up in, about 3,000 people. I graduated in a class of 52 kids in high school. I went to Indiana University of Pennsylvania, played college football there. I was a strong safety. And then I went to LECOM, which is Lake Erie College of Osteopathic Medicine in Erie, Pennsylvania, where I did my med school. Then I went into the military, joined the United States Navy as a naval officer. I went to Naval Medical Center Portsmouth for my first internship. And then I got selected to go to flight surgery school, which is pretty sweet. So I'll go into that in a second. I did my training for about 6 to 7 months in Pensacola as a flight surgeon, and then I took care of the pilots at VT-10, VT-4 in the training wing 6 for about 3 to 4 years, where I pretty much just acted as a primary care physician, really trying to get the pilots to achieve their medical readiness, make sure they're able to achieve the mission, making sure they're able to fly their flights and train their students. Then I went to residency at LECOM up in Erie, Pennsylvania. Then I did a sports medicine fellowship at Houston Foundation in Columbus, Georgia, and now I'm here.
Wow. That is quite the journey. Quite the journey.
Yes, it is.
Quite the school. Talk a little bit about your time in the military, kind of what that experience was like. Did you know you always wanted to go to the military, or was that sort of just like kind of as your sort of the career, your life kind of panned out, it was a good opportunity?
The military is awesome. I would do it again all day. I would not take back the chances, like the opportunities I had in the military. The only one of the big reasons why I came down in the South to Cullman is because I got used to living in the South. I got used to living in the nice heats. It's very humid down here compared to the snowstorms up north.
Not any snow tires most of the time here in Cullman. Occasionally,
right.
We've probably had more snow in Alabama, in northern Alabama lately than we typically do, but it's not last year. It's nothing like what you're probably used to growing up.
Yeah, and I really wanted to give back to my country, and I knew I wanted to go into the military. My older brother's a military orthopedic surgeon. My dad was in the U.S. Army. A lot of family was in the military. I felt like a good sense of duty to give back to my country, and the amount of people I got to help, the pilots, everyone I met, and had a chance to mentor. I wouldn't give that experience back for the world.
Yeah.
I got to some of the cool things I got to do. We got to fly in the T6, which is the turboprop trainer, the T45, which is the jet trainer, and we would fly low levels. We'd go up, pull about 7 Gs, positive, 3 Gs negative. You're wearing a full flight suit and gear. I got to help out with the Blue Angels as well. They're right across from the squadron from mine. I got to take care of some of their patients on occasion. But just the jet noise and flying, I mean, we flew out and into Asheville, North Carolina. We went to Vail, went to Key West, and they're always happy to take Doc along. So I was always very happy to do that. And a lot of responsibilities that I did have, I had to pretty much, I was the squadron medical officer. So I took care of all their medical issues. And if medical issues arise, I would talk to my chain of command, and I had to talk to my commanding officers and sometimes admirals. And we'd deal with things like hypoxia. So sometimes people wouldn't have oxygen in the aircraft. Sometimes I deal with decompression sickness. So if you lose cabin altitude or cabin pressure, you get something called decompression sickness. So I got to deal with a lot of kind of life-threatening events as well. And I really think it shaped me to be the guy and the doctor I am today, and allowed me to be a better leader. And then right now, it's like I can relate to patients that have been in the military. I can be like, hey, I understand what you're going through because I've been there.
Yeah.
My time.
And so as far as, the training, obviously, to be in the military and the role that you had, the medical side's a huge part of it. Was there sort of a physical, was there training that you had to do outside of, and just give us a little high level on what that looked like, of just outside of like the actual, your orthopedic surgery mindset.
So anyone who's in the military, whether you're an officer or enlisted, has to meet the basic qualifications. You have to do a 1.5 mile run. You have to do sit-ups and push-ups. For flight surgery, all the doctors have to go through it. You go through the same aviation pre-flight training as the pilot suit. So you do water survival. The biggest, I don't know if you've ever seen it, but there's something called the Helo Dunker. They take you this big cylinder and they put you underwater, blindfolded with no oxygen, and they flip you like 3 or 4 times, and you have to escape. They make you swim a mile in your flight suits, or in a pool with a bunch of crowded people. They try to get you to panic, so they're trying to get you to train to basically, if that were to happen to you, even the doctors can survive. So if you look
Yeah.
at helicopters have one off aircraft carriers, they basically, their survival rates are super high because they've already went through the training. So those are just some of the things
Wow.
that we had to go through, and it's funny because the Navy really believes that the doctors have to go through the training, because then I can understand, hey, I can better understand how to treat you as my
Yeah,
patient. So
100%. And you've kind of been in a scenario that is maybe similar to some of the patients you're seeing, and so you kind of know how you felt in that moment
yeah.
potentially, and you can then better serve them and better treat
Yes,
them.
exactly. And I think that gives me another kind of facet to me being a surgeon in a small community that I can relate to, because the military is everywhere. You run into military at Walmart, at, CVS, or at the DMV. They're everywhere. And you just really have to understand what they went through, because they went through a lot worse things than I ever have.
Mm.
They were over there deployed, and fighting in battles, and, so it really helps me kind of cater to that population.
Yeah, and so kind of transitioning now into your time now here in Coleman, as an orthopedic surgeon here at Cullman Regional, talk a little bit about kind of the areas of focus that you're kind of specializing in, and
Okay.
sort of kind of walk us through maybe. So I know as we're sitting here, you have your first surgery next week.
Yeah, Monday. Yeah, so I've been here for like 2 days, and we're scheduling patients for
Yeah.
surgery, which is very exciting.
Yeah, and so I obviously, like, as an orthopedic surgeon, you can do a variety of things,
Yes.
but I mean, everyone kind of has a kind of a niche.
Niche. Yes.
So talk a little bit about what your niche is.
Okay. So I did do a sports medicine fellowship with the Houston Clinic, which was great training. So I do have advanced techniques in rotator cuff repair, ACL reconstruction, um, ankle arthroscopy, and those, any type of sports injuries. So I do have that extra year training just in sports. But being from a small town and training in a small town, that's the reason why I wanted to come to Coolman, was because in a small town, you have to treat everybody. You have to be, I want to be the one, the last, not one of the last people, but I want to be the person that treats everything. Now that we have this big variety of fellowship trained surgeons, which is a good thing, I think, but I think less and less people are kind of, not venturing out and treating everyone. In a small town, you need that. You have to, I want to be the physician or surgeon that treats everything. So to answer your question, I'm truly a sports trained generalist. I like to do everything. I'll do everything from shoulders down to the ankle. So I start with shoulders. So I'll do rotator cuff repair. I'll do any type of shoulder replacement surgery. I train with some shoulder and elbow trained surgeons at the Houston Clinic, which are great. And I have a lot of different newer techniques on shoulder replacement, which I think is a good thing with the people with shoulder arthritis. I can do rotator cuff repairs. If the rotator cuff is not repairable, there's certain things I can do in transfers to help you get back to that higher level. I'll do anything in the elbow, the hand. My first surgery is a hand surgery on Monday.
Okay.
And then I do hip replacements as well. I will use the Mako robot. My son's name is Stryker, so with a Y. So my older brother helped name my son. But Stryker's, the implants we use for total knees, total hips, and total shoulders. So
Wow.
I will use the robot. I think the robot's a great addition. I know they've been using the robot here for a while. It really allows precise placement of the components to allow you to have the best outcome. I do my hip replacements from the front. It's called a direct anterior approach. It's minimally invasive. You'll have less bleeding, you have less pain, and your rehab is a lot quicker with that type of surgery versus a surgery from the back.
Gotcha.
And then same thing with the knees. I'll do a traditional knee replacement with a robot as well. So I'm kind of all over the place.
Yeah.
I want to be just the person that everyone can come to for most of their problems. And if there's something that requires something that, I don't have the expertise in, I'll help them find someone. But, I feel like I can kind of treat, most parts of the body.
Yeah, and so with that fellowship that you had in sports medicine, was that sort of did you always know you were going to go in that direction, or did your time playing football and kind of in that sport realm, kind of as you were in the orthopedic surgery path, that became an opportunity where you're like, this is definitely something that I already have interest in personally, that then I can also help patients with?
Yeah, of course. Yes, so I played. I played basketball, football, and baseball. It definitely had a factor in my decision. I was very interested in treating, athletes and their injuries. And I really think that the sports fellowship in particular, it helps me be a better surgeon because sports is all over the body. So sports, we train in shoulder, elbow, hand, hip, knee, and ankle, and foot. So it allows me to get more especially training in the entire body to allow me to be a better general orthopedic surgeon, which I think, again, I think that's the most important thing about being in a small town and I can relate to is that, you have someone that kind of can treat the whole body.
Yeah. And so as we kind of wrap up the conversation and people that are listening that are, Cullman residents that, maybe already have primary care physicians here that are just kind of getting to know you, what would be kind of the last thing you want to leave them with as far as who you are, kind of the work you're doing and kind of what you're looking forward to here at Cullman?
Yeah, I probably leave with that. I'm a very hard worker. I do have a good training background. I just want to make sure the patient is taken care of first. That's my first priority is the patient. I want to be available to the patient. I want to make sure I take care of them in any way possible. I think having that physician-patient relationship is very important. And especially, the first, couple of years and throughout my career, I want to make sure that when a patient comes to me, that I hear them, that they listen to me, I listen to them, and we make a team decision. It's not, hey, doctor, like I'm telling you as a patient what to do. No, you're the patient. You get to decide. We make a team decision. When you come to me, you're going to get that. I think you're going to get the relationship with me, and I really value that relationship. I want to really spend the time with each patient because a lot of the patients I've seen that were unhappy were like, hey, doc, I only got a minute to see the doctor. I'm going to spend as much time as I can with you as I can and answer all the questions that you have and give you a good outcome.
Awesome. Well, I appreciate you being here today. I think you'll definitely be on future podcast episodes diving into maybe more of the specifics of some of your specialties.
I'd be happy to.
But I think as today, kind of giving the overview of who you are and welcoming you here to Cullman Regional has been great. I feel like you're off to a hot start already with the patients you've been able to see and the surgery already scheduled.
It's coming quick.
So it's exciting that you're here, and I look forward to having you back on the podcast soon.
Hey, thanks for having me. Appreciate it. Thank you.
Yeah, thank you.
All right.